Dr. Kahan, if you would be giving your viewers one or two or three advice, like, a package of like really the main thing of what us people, maybe young ones different than old ones, what are we doing wrong, neglecting, and or what are we doing right? Kind of like, what are some of the main things you would tell a person like me and another 300 million people in this country how to take care of our feet so that we avoid certain problems, whatever that might be?
That's a great question, Helmut. I would have to say the number one issue, and people sell themselves short when they buy improper shoes. If you're going to put something on your foot, it better protect it. It better support you. And as I tell people also, treat your feet, treat your body the same way you would your car. In other words, here's an analogy I use often for my patients. Imagine driving your car without shocks or struts and you're bouncing down the street. Well, guess what? Improper shoes. I tell people, I'll look at their shoes and say, you'd be better off in a paper bag. Proper shoes are extremely critical. I should probably I should have a 5-page website just on how to pick out a proper shoe. And now that we're talking about this, I probably will do that. Shoe gear is extremely important. One thing that's neglected from a body standpoint as a whole is people need to realize that taking care of your body is not just good, proper nutrition and eating right and exercising. People need to stretch their body, stretch their muscles. That is so critical to slow down the aging process and slow down the joint, wearing out the joint process, arthritis. And there's a number of different types of arthritis. So stretching, exercise.
Dr. Kahan, and it's of course a personal question at this moment. Is stretching, you mentioned stretching, and of course now you're really dealing with the whole body, but everything is connected to everything. Like I'm not so sure, tell me yes or no in a very fast thing. I think apparently every nerve or muscle or both, what do I know, meets at the sole of the foot. So it all has to be connected. But my point is stretching the same than exercising, or are you talking something slightly different here?
No, totally different. People,
Totally different.
Totally different. If you go to the gym, you see people lifting weights, running on the treadmill, on the stair stepper, doing all sorts of stuff, and then we're done, they go home. When you pay attention to it, if you go to the gym, you'll see for every 10 people that are doing all this stuff, you'll find one that's sitting on the floor and stretching their legs and touching their toes and doing things that are a very integral part of keeping the body in fine tune. So yeah, two totally different aspects. I mean, it's like it's like a heart surgeon and a foot surgeon. They're two totally different parts of the world.
Okay.
So very, very different.
Are you going to make a 5-page website about stretching?
No, but maybe I'll make a 1 or 2 page website about it. But I'm not going to be the model.
I got it. No, you're getting the point across very much. What else, Doctor? What else? We have shoes. We haven't talked which type of shoes yet, but we'll do that at one point. But we have shoes. We have stretching. What else?
In conjunction with shoes, also some type of a shoe insert, whether it's a custom orthotic or a custom insert to help protect the foot. Again, that's all part of the shock absorbing system for the body is very essential, whether you think you need it or not. A nice padded insert inside the shoe. I tell a lot of patients, pull the insert that was in the shoe when you bought it, put in a specific type, either that we carry here or that they may be able to buy it at a. You're going to say something.
Well, no,
you're not.
For you to finish, but you finished. They can buy it somewhere. But so
I may never finish.
Are you telling me that all of us would be benefiting from an insert? Not only the ones who have a shorter leg, or the ones who have a crooked leg, or the ones who have a flat foot, and by doing so, need it. We know about those things, most of us, that then an insert might help to correct that. But are you saying that a normal, good, decent, healthy, growing person would be benefiting from an insert?
Absolutely, no doubt about it. I'm going to go back to my analogy that I brought up earlier about the worst case scenario. If the insert did nothing else but act as a shock absorber to the body, and you started doing this as a young age, by the time you reach our age, your bones are going to thank you for it. So it's extremely critical, in my opinion. It's very simple, very inexpensive, and a great thing to do for the body. Absolutely.
Wonderful.
Affects head to toe.
Yeah, wonderful. What about maintaining, we know that the foot is one of the first areas where we could be, collecting sweat and smell and stuff like that. And what about that type of maintenance? Is there something we on an average overlook till it's too late? Is there something we could constantly do to not have those problems occurring, which might or might not, you tell me, avoid things like a fungus or so, because those things grow in wet and dark and whatever?
Yeah, absolutely. That's an excellent question also. Another critical aspect, and some people are worse than others. At the end of the day, if you take your shoes off and you find, oh my gosh, the whole world's complaining about the smell of your feet, using a spray foot powder or a shoe spray, or let me back up beyond that. The technology in socks nowadays and in materials that we wear, you'll see moisture wicking, antibacterial. Well, guess what? There is something to that. And a good pair of cotton socks or a cotton blend sock, whether it's a dress sock or an athletic sock, that is a moisture wicking material. I'll tell you what, it does wonders for helping to prevent, stinky feet. Athlete's foot that can progress to infecting your toenails and getting toenail fungus. Toenail fungus, that's a whole different discussion. So a very important point as far as socks in conjunction with a proper shoe. Absolutely.
Right. Good. So proper shoe, we're going to go into it in a little different video. Inserts, you think they're very, very important because they, it makes sense because, so is it possible that a person who wears inserts all his life, he's walking out there, he's doing things and whatever, that he might just simply, because of it, avoid or at least majorly delay his knee surgery? Or at least his knee pain,
absolutely,
because he's shocked. He has a shock in it, as you say. That's wonderful.
Shock absorber, exactly. Yeah,
that's wonderful. So we have that. We have, wear the right socks, and of course, probably the shoes have something to do with it. I'm sure if you wear plastic shoes, you sweat a little more compared to leather shoes or whatever. Anyway, wonderful. Thank you very much. It's very informative. Thank you.